In gastroenterology, we work closely with various members of the care team for the patient. It starts with their primary care physician. We work closely to identify other needs that they may have that impact their digestive health. The beauty of working with MedStar is that we have all these specialties under one umbrella, and we can easily, seamlessly communicate with one another. The most common conditions that we treat in gastroenterology include a variety of conditions that cause abdominal pain or abdominal discomfort, reflux, constipation, irritable bowel syndrome, inflammatory bowel disease, among others. Typically, when patients come to us for the first time, they're in a lot of distress, a lot of discomfort, and that's actually a very humbling experience for me as a provider to be able to participate in that healthcare or health journey of the patients. In terms of how it impacts their quality of life, one of the statistics that's typically discussed is that irritable bowel syndrome by itself is the second leading cause of absenteeism in the United States. Absenteeism, in terms of work, impacts their quality of life in terms of how they're able to function or even perform their everyday activities. And clearly, you can see how such a condition can impact their lives negatively in that way. And that's why we're here to help, to get them back on track, to get them back to where they need to be. When a patient first comes to us, their treatment plan is tailored depending on how they present, how they feel, what their history is. Depending on that initial visit, we make that determination whether they need to have a procedure such as an endoscopy or a colonoscopy. And their treatment plan can then be tailored based on the results of those diagnostic testing, a variety of which is available to us at MedStar Health. And working together as a team to develop that treatment plan specific for that patient and their needs to get them back on track, to get them back where they need to be. Here at MedStar Health, we keep up to date with the advances in evidence-based medicine and the latest technologies. Most recently, we did have a refresh in terms of the newest equipment for our endoscopy suites. So we now have access to high-definition screens and the latest technology in terms of providing the best care for our patients. You could say I was exposed to the health field at an early age. My father himself is a gastroenterologist, and overall, I've seen that impact that he's had, and it was inspiring. I knew I wanted to help people, and that was the best way I knew how. On a day-to-day basis, it's easy to get lost in the mountains of paperwork and messages that we all have to get through as healthcare has evolved. But one thing that keeps me going on a daily basis is the fact that I'm part of the healthcare journey of this patient, and seeing them grow and have a lasting impact on their health and in their overall well-being is always a humbling experience for me.